Okay. Right.
டிக்கெட் பார்த்தேன்னா 7,000 ரூபாய் வருது. அதை மாத்தி அதெல்லாம் பார்க்கப்போ 7,000 ரூபாய் ஆச்சு.
Hello everyone, welcome to MRCOG Part 3, 6-month Smart Preparation Plan. That is the orientation of the upcoming batch for November session. So I welcome you all to this new batch. And here we go with our preparations for the next exam, how we'll be going towards the success in one go. And of course, with 70% less study time, as always, our tagline is for MRCOG courses. So, warm welcome to you all. Hello. And welcome.
Good evening, ma'am.
Good evening. Very good evening. So good to see you all here. I think more will be joining soon. Okay. So I'll be talking about in general how we will proceed with the course. If you have any specific questions, you can let me know right now, or you may interrupt me in between as well, or maybe we'll talk about them later. Anything you guys want to say now? Okay, so I think let me first take you through the part 3 journey, and then you can ask your questions. That would be a better option. So here it's welcome to MRCOG part 3. It is totally different from your part 1 and part 2 exam, because in part 1 and part 2 exam you were just reading, and then you have to frame some answers, think about what is the correct thing to do, and then just go and tick there, right? Of course, it is not just tick, because everybody who has done the part 2 knows that ticking one answer, how much effort it takes. So part 3, I think you will definitely enjoy, because it is more about talking. You have to learn now whatever knowledge you gained in your part 2 exam, how to transmit that knowledge to the patient, right? That is the part 3 exam. So now whatever knowledge you have, how to frame that into while giving the management options to the patient, how to deal with that in the clinical scenarios. This preparation when you will do, of course, because you are not, if you are not from the UK, you will find it quite, and why they are doing so, why I have to do this, that. You may have plenty of questions like that. And why I have to speak like this. But finally, you will come to know once you have gone through this process of MRCOG Part 3, once you come into the practice, you will find a complete transformation of your personality. And that is the beauty of this exam. So once you are through this, definitely your way of managing the patients, your way of talking to the patients, your soft skills, your communication skills will be much, much, much better as compared to when you are starting now. So throughout, we have to focus on all these points. So it is not only about the knowledge, it is about your knowledge, skills, attitudes, and competencies. So on one side, you need to know how you are doing this task, and how, if you are demonstrating any skill, like this time there was a task on the neonatal resuscitation, and the mannequin was there, and ambu bag and all this was there. So you have to show that on the mannequin, like how to do that. So it's about the skill testing. Knowledge, definitely, if you do not know what is the right management, how will you talk about that? So knowledge is definitely important. Then attitudes and this. So this is your non-technical skills, right? How you are communicating to the patient, breaking bad news, angry patients. Sometimes you have to negotiate with the patient. Patient is not ready for something which you actually think that is best for the patient. So you have to deal with that kind of scenarios. And they are not new scenarios. Every day in and out in our practices, we deal with these scenarios. But up to now, we were dealing with whatever we felt was right. But now we will be talking about evidence-based approach for these scenarios so that you have a structured framework. Like if a negotiation station is there, I'll follow these steps. If it is a breaking bad news, I'll follow these steps. So very fixed. Everything is very structured. It's not something that I'm going to create from something or you have to create for your own in the exam. No, it's totally structured. You just have to follow that structure and stick so that you get the maximum marks. So we will be learning all those structures when we will be following those types of stations in the course. So what is the agenda? Understanding the exam format, very important, right? Very important that you understand how the exam is. Why it is important? Because if you want to see that where should I focus to gain more maximum marks, right? What is the point where I can put in a small effort but gain more? So that is why here lies the importance of understanding the exam format. Types of stations. What are the different types of stations you should be ready for? What are the domains tested? In part 3, it's not about right, wrong. It is about, you are going to talk about 5 domains like information gathering, your communication with the patient, communication with the colleagues, patient safety, applied knowledge. So you will be tested on those domains, right? So your preparation should be based on the domains. Of course, you need to know about the right template for that station, but knowing domains is also very important. Because if any domain is continuously missed in every next exam, every next station, sorry, so that becomes your lagging domain and that reflects in your marks. So it is very important. If you have less time, you can compromise on leaving some of the points of the domain you have covered, but touch all the domains, right? So knowing once you are studying, then it is very important to know and focus that you are touching all the domains. If you are not talking about the domains and you are just going through the template and mugging it up and ready to prepare and present that template in the exam, I'm sorry, absolutely it's not going to work, right? So we have to work domain-wise. Understanding the scorecard. Again, why it is important? Because once you know this is the scorecard, then you know where to focus, how much time to focus where. The more the marks on the scorecard, the more you will be focusing on that particular thing. Time required for preparation. Are we at the right time? Yes, definitely. We are at the luxury of time. That's absolutely correct. Recommended reading, what needs to be read. Concept of ideal station. What is ideal station? How we should start preparing so that our stations become ideal. And how to practice stations to achieve maximum marks. So we'll be talking about all those points while I'm going to take you through the few slides which are going to come. Can you please mute? If you want to ask a question, you can definitely ask, no issues, but otherwise keep it mute, right? Then understanding the exam format. So how do we go about the exam format? So this is 14 stations in a row. So that means you will be performing the 14 tasks one after another, right? 14 tasks in the row is to be required. So what does that mean? You will have 14 chambers, right? Come out from one, enter the second, come out from the second, enter the third, come out from third, enter the fourth. Like this, you will be going into the 14 rooms. Every room, you will have 2 minutes outside the room. That is 2 minutes you are just standing outside the room and you are then reading the papers which are pasted outside the room, right? And that is your task. And that is the information provided to you. So 2 minutes you have to read all those information outside the room. And in this 2 minutes, actually you have to read that information, then comprehend that information and make a complete station in your mind, right? You have to take your mind through the complete station. And now once your mind is ready for that, then go inside and next 10 minutes you have to give your best to pass that station. Like this, again, you will come out in 2 minutes, you will again comprehend everything and prepare next. So you've seen, if you just imagine that, you must be thinking like, how tiring it's going to be. Every time you, in a 2 minutes, you have to do that. And then you go inside, do the station, come out in next 2 minutes, again prepare. So it is like a marathon, right? It's not a 1 day or the 2 day job. You need to keep doing this consistently. If you keep doing this consistently, how this will help? This will help you be prepared for the final day. You are building stamina, right? Both your physical stamina as well as your mental stamina. When you build up your physical stamina means you have enough stamina to, for next 3 hours, you will be doing these stations. And your mental stamina is that your mind is ready to focus for so much time. It's going to focus for 2 minutes on a station, bring everything, oh, okay, this, and then inside the station, 10 minutes, go and present, come out, 2 minutes again, think, go inside. And when you are inside also, not everything is going to be according to what you have thought standing outside. Role player may have some spontaneous questions. So you need to be prepared for that as well. So the purpose is nothing to get scared. It's just a practice which we are going to do. And let me tell you, we'll have enough practice in the course that by the time, if you have attended your live sessions, you are doing your homeworks appropriately, you will be prepared with almost 400 stations, right? And if you are prepared for 400 stations, then I don't think anything else can come in exam. Right now, also in the last 3 days, whichever the exam was there, I think every candidate has given me the feedback that exactly what was discussed in the class came up in the exam. So that's why if you are practicing with the class and doing your homeworks appropriately, I don't think anyway your practice is going to be lagging. But it is very important that you follow the schedule, because in part 1, part 2, you can sit at home and read just listen to the recordings and it goes fine. But in part 3, it's your talking. Unless and until you come to the class and you present your station, I can't correct you. Unless and until you send your homework recordings, we can't correct you. So therefore, this is very important that you remain active. When you have thought about the November exam, now it's time to become active and start. Okay, so that's the first thing which is required. And definitely I don't need the plenty of hours. You can just record in 15-20 minutes and send, and you will get a feedback of the recording which you can work on and improve your next recording also. So this is how it's going to be. Now these are the various modules. We are very well accustomed with all these names. There is no new thing to that. So we'll be covering all these modules definitely. Now these are the domains tested. This is the main thing of the part 1. This is the main chunk of the part 1. Part 3 exam. If you do not go by the domains, you are lagging the crux of the part 3. Understanding domains is the main thing. In your website, if you have seen that initially the first module is understanding domains. So a particular segment is devoted to this particular topic. Why? Because if you know exactly what this means, then only when you start talking about the station, you will come to know how actually what the domains actually you are covering when you are talking about the template and what you are not covering. So it is very much important to understand what is included in this. In this session, only in the end, I'll take you through 4-5 slides. We will talk about the common points included in this domains. I'm not saying all the points I'll be discussing, because every station has its own specific points. but at least the common ones. So even if you know what are the common ones, you speak about those, then at least 50-60% part is done. So you are still ready for your borderline performance. So you add more and you pass, right? So patient safety, communication with the patients and their relatives. Now, communication is important as a domain, right? But when it is a lay examiner station, lay examiner means any simple non-medical person is also sitting in 4 of the stations. So in those 4 stations, that simple non-clinical person is observing how you are talking to the role player, right? How you are talking to your patient. So he will also mark you separately. So 4 stations will have 4 extra marks from the lay examiner. Now, so lay examiner becomes very, very important, right? 4 marks in 4 stations you are getting for that. Now, if you have communicated nicely with that patient, your lay examiner will be happy and he will mark you. And if he gives you those extra marks, they can be very, very important in your either passing the exam or maybe getting a good percentage in the exam. So very, very important to get those lay examiner points, and they are totally communication points. So the communication with the patients and relatives is important because communication domain is there, but it is also important because lay examiner is also going to mark you for that. Communication with the colleagues. Very easy domain where you can just pick up the marks like that, right? Because if you are fixed, what are communication? You take those names, 5, 6, 7, 8 names, and you score the marks. So communication with the colleagues, information gathering. This is history. This is history points. And then comes your applied clinical knowledge, which is actually your knowledge, right? So this is how we will be talking about when we do the stations. We will be talking about the template. I'll give you the ideal template also, like how this station needs to be dealt with. But simultaneously, also we will talk about the breakup into various domains. So that when you are doing, you know exactly what you are talking and how you are covering the domains. Overall, when we try to understand the scorecard, in exam, you are scored for almost 70 domains, right? Now, how do I calculate the 70 domains? In every station, like this is a simulated patient task, and it assesses you on information gathering, applied knowledge, patient safety, communication with the patients, right? So this way they have mentioned you 4 domains. So if I count these in 14 stations, then you are tested for almost 70 domains, right? 70 domains when I count these number of domains in all of these stations. Now for this, for every domain, you will mark either pass, borderline, or fail every time, right? In every station, you will be marked like that. Now, how do you get pass? How do you get borderline? And how do you get fail? When you speak up to 80% of the points, you pass. If that station required 10 patient safety points, and you talked about 8 points, so means you pass. If you have dealt with 6 points out of 10, you are borderline. And if it is 5 below 5, it is fail. So you remember, now you know, if when you will be practicing in the stations, then you can mark yourself also, right? You can yourself see that if you are not speaking so many points, you are at the borderline. If you are not speaking, if you have told only 6 points, you know that you are stuck here. If you have left with 5, 6 points, you know you fail the station. So it is very easy to mark yourself also if you understand this. And since you know what is happening around, so where is the problem? So you are the right person to solve that problem as well. So once the problem is clear, it is very important to, very easy to solve it. So picking the problem, I give you the complete that chart, right? so that you can easily pick up where you are lagging behind, in which domain you are lagging, and you can start working on that. So that is how the things are going to be, and you will need to work in this way. Fine. Any questions till now? Anything you guys want to ask, or shall I continue? Okay. So let me continue. So types of stations. There are 3 types of station: structured discussion stations, lay examiner, and simulated patient stations. And there is another simulated, which is the 4th type, which is simulated colleague task. Okay. Now, so basically your structured discussion tasks are where you are talking to your examiner, right? You have a case, examiner has a case, or maybe he's going to ask you about any particular topic, and he has some questions for you. It is a simple Viva kind of a situation we always have been doing in our medical days. So the consultant is going to ask you the questions and you are going to answer those. So that becomes the structured discussion. Now coming to what are the simulated tasks. Simulated task is that there is some actor who is simulating the patient. So it is simulated patient task. If that particular role player is simulating the colleague, he's simulating your junior, so that becomes the simulated colleague task. So simulated patient task and simulated colleague task. Now in a patient task, you are talking to patient. You have to take her history, tell her that what is the differential diagnosis, explain her the diagnosis. If she has any reports, you will have to explain her the reports. And then finally, you tell her what is the good management for her. So like this, you have to talk to the patient. So that becomes your simulated patient task. Now in the simulated patient task, there will be 2 types of rooms. One room is there where you are talking to the patient and your clinical examiner is observing you and marking you. In another kind of a room, you and patient are talking, clinical examiner is watching you, but there is lay examiner also. So there is 4th person also in the room. So therefore, it becomes your lay examiner task. So simulated patient task can be with the lay examiner or without lay examiner. Now another is simulated colleague task, where your junior is there and you have to teach. Like you are asked to teach him breech delivery. You have a dummy pelvis with you and you have to teach him. So that becomes your simulated teaching task, right? Simulated colleague task. So this is how different types of stations are. How many marks for each station? So how many it depends on what are the number of domains. If it is 5 domains, it will carry 10 marks. If it is 4, it will be 8. The total number of marks per station is not actually same because it depends on the number of the domains. But ultimately, it's not the number of stations where you pass, it is the number of domains you pass. Okay, you will be marked per station, but your pass fail depends on the marks per domain, right? So overall, all the domains carry equal importance and the marks in your different stations become average out, right? So this is how it works. But overall, with experience, if you ask me, then out of 14, you should do at least 8 to 9 stations very good. That is, you should be able to pass those stations. Then 2-3 stations or 4 stations, you can be borderline. But 1 or 2 stations should be fail. If it is more than that, then it becomes a problem. And trying that the same domain is not affected by the same domain is not affected again and again. That's a very, very important thing. If different domains are getting affected, then it's fine. Still manageable because it will average out. But if the same domain is getting affected, then it is not averaged out and then there is a problem here. Fine, so that's it. Okay. So what is the global marking? So global marking is that there is a kind of a standard setting is there, right? So you have a combined standard is already set that this is the standard which should be minimally achieved by the any candidate who is liable to pass. And then according to that, your performance will be marked from wherever you are attempting the task, maybe in the India, maybe in the Singapore, maybe in the Abu Dhabi. So you are marked on that particular one standard which has already been set, right? Is there a timer after 10 minutes for each? Yes. At 10 minutes, a buzzer will ring, right? A buzzer will ring and you have to stop and just move on to next. If you stand there speaking, then you are losing your 2 minutes of the next station because there will be two buzzers, one at 2 minutes and one at 10 minutes. Now your 10-minute buzzer rang and you did not move out and did not go to the next station. So what will happen is that your 2 minutes are going on, right? You have not moved, but your 2 minutes are going on. So when the 2-minute buzzer will ring, you will have to enter into the 10 minutes in the next room. So you are losing that time, okay? So it's very important to follow the buzzers so that you get appropriate timings there. Fine. Any more questions? Good. Okay. Fine. So let's move on. This is, you see, there are how many people here? So what do you think? What kind of a station is this? What kind of a station is this?
Structured discussion.
And
Okay.
simulated patient.
Simulated patient and anything else? Because patient is there, a candidate is there, examiner is there. So who is this person? Yes, SPT with lay examiner. That's the correct. So now you see how the people are. Like this lady is the role player and she's the simulated patient. You are sitting here, you are performing the station. This person here is the clinical examiner, and this lady here is the lay examiner, right? So this is the room where the structured simulated patient task with the simulated patient task with lay examiner is there, right? Number of persons in the cabin as you are entering. In the simulated patient task, there are 2 people. One is the role player and one is your examiner. In lay examiner station, as you enter, you will find 3 people. One is your examiner, one is your patient, and one is the lay examiner. And in your structured discussion task, there will be only 1 person, right? So this is how you can differentiate as you enter. And of course, this is just to explain you, but otherwise it is written outside in your task as well. This is a simulated patient task. This is a structured discussion task, but this is all, I think, initial apprehensions are like how I will come to know about this and that. So just to overcome that. So how will we be preparing in next 6 months? First 3 months, we will be focused. Yeah.
I'm sorry. Can you just explain what is lay examiner once more?
Lay examiner is a non-clinical examiner, and he marks you for your communication skills, how you are dealing with the patient from a non-clinical point of view. Okay.
But
So
the lay examiner will never interact with us.
No examiner will interact with you except in structured discussion. Because structured discussion, the examiner is there to ask you the questions, but otherwise no examiner will interact with you. In your simulated patient task, you will be interacting only with the patient. She will be asking you the questions as a patient is asking you the question. But no examiner will interact with you except in structured discussion.
Okay. So the patient will be there and the examiner will be just sitting there beside that.
Just sitting and marking you.
And after we finish, like once a 10 minutes buzzer rings, we just stop abruptly and leave the place, ma'am.
Yes, you have to just move on to the next.
Okay, okay.
Patient role play will be from UK, not necessary. Not necessary. Usually it is from the local areas. Like if you are in a Delhi, the North Indian people will be there. If you are in Kolkata, you will find that kind of a people. So usually they are from the local areas only. Examiners do sometimes come from the UK and sometimes from the local areas. Like this time there were some issues with the flights and all safety issues was there. So nobody came from the UK. It was totally the Indian examiner. But usually some of the examiners do come from the UK. But role plays are usually the same local people who are wherever you are appearing. And if you are appearing in the UK, then definitely you will find the UK people there. And it's not like that. They are quite cooperative. Role players are very much trained and they are very much cooperative. And actually, they are the people who have your question paper because they will be asking you the questions. So you think your role player as the best friend in your exam if you really want to pass, right? Think them as your best friends. Do whatever they say because whatever they want you to do is giving you marks. So always remember, follow your role player. Fine. So in first 3 months, we will be talking about the basic modules, right? We will be talking about the basic modules. One by one, we will cover all the modules and we will cover the tasks related to that module. Every module, we will have 10 to 12 tasks in the class and we will be discussing about that. So every this thing will have, so you will have almost more than 140 tasks as we finish these 12 modules. So this is how we will be going on for next 3 months. Once you are thorough with the basics of every module, once you are thorough with that, then we will move on to the tricky ones, which is the recall stations. These 3 months also the recall stations. They are also the recall stations, but they are the direct recalls. The next 2 months would be more brighter, more shiny, because we will be talking about the tricky recalls, where 2 or 3 modules are they are simultaneously working in a single station, right? Like this time they gave you a scenario for twins with 18 weeks pregnancy, one baby died. Then it is how will you manage? And there was PPROM also, like how will you manage? So now what all they have asked? They have asked you about the PPROM guideline. They have asked you about the twin guideline, and they have also asked you about the IUFT guideline in the same station. So multiple things can be asked together in a single station. So these are known as the tricky recalls, and we will be talking about all those in the level 2 when we will be working for again 2 months where these sessions will be. And after that, before you are exam ready, we will be having a 7-station mock to give you the exact practice how the exam goes on. So this way, this all is included in a simple, the course which you all have, for those who have opted for the full course, they have all this included. And certainly from step 1 to step 2 and step 3, you will be completely prepared for your exam. So no need to go anywhere or take anything else, and that will be the perfect thing for you all. What is the pass percentage for what? For exam or for course? For exam, it is 60% almost. Good. Don't worry, we have much higher pass percentage. So you are going to pass. Don't think about that.
No, ma'am, that I know. That's why I didn't ask about the course. I just want to know the general.
Recommended reading is GTG Nice and Talk will be your basics, right? GTG Nice and Talk will be your basics. But now we don't have to go through them in very much detail. You will be talking about those in a very broader term, right? Very much in the bullet points, because you have only 10 minutes. Out of 10 minutes, also for applied knowledge, it is only 3 minutes, 4 minutes. So you have to be very selective in reading those, right? Read only the highlighted points with that. And I think those who have done the part 2 with us, they must be having their part 2 access as well. So they can always go back and revise from there also. So this is your main thing which is required for the theory. Now, once you start speaking to the patients, then you need the patient information leaflets. So patient information leaflets are the mainstay. These are the new things which you need to read. Once you go to the website, when you start looking at the website for every module, first is expected stations. So there are all the expected stations of that module are mentioned. And below that only, in the download section, you will find all information leaflets. Now, all the templates which we are using in the course are prepared from the patient information leaflets. So you can read you will be getting the templates, but for some extra knowledge, you can go through the patient information leaflets at least once, maybe, because many times exactly the question which is mentioned in the patient information leaflet is asked by the role player. So that's an important thing. This is how you will see your patient information leaflets. And you will find here, it is in a patient-friendly language, right? So like it is mentioned that your baby is surrounded by the amniotic fluid or water is contained within the membrane bag inside your uterus. So it is simply how to explain this to the patients. But I think I have also pasted the slide where I have mentioned I've used this to prepare the template. Yes, you can see here. Now the same information I've used here. So explain the diagnosis of PPROM. From your history and examinations, what I understood that you have a problem called PPROM. Do you know anything about that? Now I've added the rules here, right? Whenever you have to explain the diagnosis, you have to first check the understanding. First check her understanding, then second thing is to ask her, tell her actually what is normal, right? And then tell her what is abnormal and what happened with her. So this step-by-step process is very, very important. If you do not tell like that, then the structure is not met, right? So we take the information from PIL, but how to present, how to structure it, that we discuss in the classes. So now I first check the understanding. Do you know anything about that? No. Now I'll tell about the normal. Your baby is surrounded by the amniotic fluid or the water is contained within a membrane bag inside your uterus. When the water breaks, it is also known as the rupture of membranes. Normally, the water breaks just before or during the labor. But if same thing happens prior to 37 weeks, then we call it as a PPROM. This can happen. How common it is? It can occur in 3 out of every 100 women, and it is associated with the preterm births. So why it happened, we are not clear. And next thing to talk about is what is the outcome, how this affects the patient. This is very important, because if you are telling the patient the membranes has ruptured, okay, she is looking at you. So what happened? So because she need to know what is the outcome, how this is going to affect her and her baby. Unless you tell the outcome, your diagnosis is not complete, because that doesn't make sense for the patient, what has happened. So these things we need to talk about when we are going through the station. And definitely we'll be working on these things when we are through, you are practicing your cases, we are discussing the cases every day, these will be dealt with. Now this is your recommended reading, but no need to go through all this. We are already covering enough stations, but if you still want, then these are the 5 books, good books. Lisa Joel is the one which is always recommended by the RSVG, but they are good books and you can go through them. But if you follow the templates of the course and you are doing your homeworks religiously, you will not require anything from that. This is your November exam venues and the dates. So 5, 6 November and 10, 11 November is there. So we will be finishing all our classes by 15th October or maybe 16, 17 October, so that you are free after that, and mocks will be going on in the October so that you all can do your mocks also. So this is how it has to go about. We'll be following these dates. What are the normal challenges and the common concerns? One is the language barrier. If you are good in your language, then your just becomes very easy. Otherwise, no need to worry. You can start working on your language. It is nothing something you have to speak like UK English. You can speak simple English, simple words, short sentences, but speak confidently. Ineffective communication. Now, what is effective communication and what is ineffective communication? You are speaking, but you guys don't find it interesting. You are not able to concentrate on what I am speaking. You are not able to gather the information from what I am speaking. Then my communication is ineffective. And if what I am telling you and what I want to explain, you are getting it, it's effective communication. So unless the communication is effective, it is not important. Inconfident. Don't feel inconfident. You know everything. You have passed the part 2 exam. You know everything. Now it's only about the practice and the structure which you have to create. Time management, 10 minutes. If they remove this 10 minutes clock from the exam, I don't think anybody is going to fail, because it's the problem only that you have to see what to exactly tell in these 10 minutes, how to cover up important points in 10 minutes. So from the very beginning, start working over it. So when we start practicing, I'll guide you, like speak your this words in only 30 seconds. Speak your this history in only this much time. Up to agenda, take only this much time. And from tomorrow onwards, in the homework group, Dr. Shriya will be posting some kind of a station, right? Any damn station, so that you will be asked to only speak the introduction part, only speak up to the agenda. This basic practice is going to start from tomorrow. And please don't take it as simple ABC. Then why should I start from this ABC? I already know. It is very important, because if you focus on each and every part of your task, the final outcome will be very beautiful. So this is the time where you can spend time to focus on each and every part, right? So from tomorrow onwards, when you get your homework for these parts, do that homework, send the recordings, take your feedback, and keep on doing this in fixing this whole thing in a time which is required, right? So be very particular about it, and be particular about doing your homeworks. Okay, so with this kind of a practice, when you come to the class and you present your cases, at least you are not getting the feedbacks on your these small things. We are talking about something which is relevant, and we can concentrate on that. So start working, and this is very important that you fix your introduction, you fix your agenda, you check the concern, you make your history good. This is very, very important for any task. Information gathering in itself is a domain. Communication starts from right from the introduction. So these parts should be very, very important. So please follow that. Patient safety, of course, is very important, and then inadequate knowledge is the last thing, which I don't think anybody of you have a problem like. Our approach to the preparation. So first, we will tune you for 2 minutes outside the station. In our classes, I focus a lot about how to utilize your 2 minutes, because I told you need a proper practice on it, right? So that you can comprehend the station in 2 minutes. Then comes the introduction, setting, and stage. This is what you are going to practice from tomorrow in the homeworks. Information gathering, history taking, this is all will be covered in the regular practice, so that you can do everything well in time. Then comes the next part, explain the diagnosis. We will be focusing a lot on this when we are talking about the stations, management plan, and conclusion. So mostly in your homeworks from tomorrow, you will be focused on introduction, information gathering, and conclusion part, right? So that this much part is prepared before coming to the final thing. So do this step-by-step process so that you are very well prepared for your exam. 2 minutes outside the station, who you are, where you are, and to whom you are talking. What is your task? What are the domains tested, so that you can cover those domains. Broader outline according to the domains. You have to write what are the important points we will be covering in. And this 2 minutes practice is going to be there in the class as well, right? So this all we'll be talking about. So time distribution will be 2 minutes outside the station, then 1 minute introduction you can just give, 3 minutes for history taking, 1 minute to explain the diagnosis, 3 minutes for management, and then final 1 minute for the conclusion, right? So this is how we have to cover it. In between, you know that this is 3, 3, 6, 7, 8. I've left still 2 minutes. Why? Because role play will be speaking too. So we have to see all these things and structure your task like this. So once you structure your task like this, at least you will not feel apprehensive for the time management by the end when we reach there. So this is important part. This I already told you, and this is how the things are going to be talked about, like what is included in the domains, so that you can know that what domains you are covering in any particular station. Yes, you can write important points in those 2 minutes. Definitely, you should write. Yes.
Okay.
In some stations, like, when we decide to draw a diagram and explain the patient, can we draw the diagram in that 2 minutes what is given and then just show to the patient?
Draw the diagram in front of the patient.
Okay.
It's already the line diagram, no? So just draw the diagram in front of her, because you will be telling her, okay, this is uterus. You can, if you draw outside and then show her, then also it's fine, but you will have a lot of things to do outside. So I don't think you will try to waste that time in drawing. Once you start practicing, you will recognize this, that there are a lot of things which need to be done in 2 minutes. Okay, so just taking you through few slides to let you know what actually these domains mean. So information gathering is history, and it should not go more than 3 minutes. It should be very relevant history taking. It should be structured. There is a proper structure to history. It's not like that you remembered something, you ask it. Mostly now they ask that targeted history. So what is meant by the targeted or the focused history is important. Don't repeat the questions. Use patient-friendly language. No jargons, no medical words. Use open questions. With history taking, keep differential diagnosis in mind. Fix your format. Each point is important. And even with good history and communication, you can pass with borderline score. If history not good, in most of the stations, difficult to pass. So this is very, very important. Now coming to history taking. So all these things are there in the history taking. So basically, in this, presenting complaints, obstetric history, gynecological history, contraception history, and then sexual history, cervical screening, medical history, and drug history, drug allergies, surgical history, family history, social and personal, job, smoking, alcohol. That's it. So one by one, we will be covering all these. Communications with the patients. Very important to pass the exam. Lay examiner stations, highly dependent on this domain. Use patient-friendly language. Ask her main concern. Check what she already knows. I just told you, check understanding. This is the part of it. So be empathetic, offer concern whenever she mentions any problem, and then offer apology if you are asking about some painful past. These are some basic norms. We will be discussing about what to say in this. So there are certain statements which you have to use. Like if she is saying, I'm really going through the difficult time, then how to go about that, right? So you will be acknowledging, oh, I see you are distressed. We are here to support you. So like this, something we will be fixing up all these statements when we will be talking about that, right? So acknowledge, always acknowledge. If she is saying that I'm distressed, don't just move forward, right? Stick to that point, stay there for a moment and acknowledge, and then go ahead. Similarly, if you are going to ask about any difficulty, like you are going to ask about her recurrent miscarriages, right? So just don't simply say that, can you tell me about your pregnancies? She has told you that, oh, I have undergone 3 miscarriages. Oh, I'm really sorry to know about that. It must have been a difficult time. How you have been coping with that? Lisa, is it okay if you can talk about those miscarriages in detail? I know it must be very difficult for you. Sorry to bring in the bad memories. So you have to build up some kind of a structure for that, okay? So these all things, not to worry, we will be practicing in our classes, and you will get the exact dialogues also if you just want to remember them from there. That will also be there. If she says about the illness of some relative of a concern and ask for the person's well-being, so these are basic things, right? We can simply follow in every station. Don't interrupt her in between. Listen to her questions. She knows where marks are. She has your question paper. So go where she is taking you. Draw diagrams to illustrate the things and check her understanding in between. Communication with the colleagues. List all the team members you need to assign the work. Chaperone, nursing assistant to take the vitals. Involve the consultant, offer psychological support. Teaching stations are particularly dependent on this because you will be talking to your junior. Bullying station, that is totally based on the communication with the colleagues. Involve safeguarding team in domestic violence FGM cases. We are going to talk about all these details as we move forward in those stations. Can we have our watch in the exam? You can have a watch in the exam, but I don't think you will be able to see that. But definitely the watch should not have any internet. What will be the daily task? What we have to do? Please explain the Telegram group. It will be posted. No, it will be posted in the Telegram group. There is a homework group. I'll just share the link. If those who haven't joined there, they can join in the homework group. And in the Telegram only, there is a homework group, and there the task will be posted, and you will be posting your recordings there. Applied knowledge is how to talk about how you are interpreting the investigations, what management plan you are making for the patient. So all these things, talking about the risks, justify why you are doing this. Structured discussion tasks are totally your knowledge-based tasks. All these things will be your applied knowledge. And then comes the patient safety, the biggest part, right? So confirm the name and age of the patient from the very beginning. See, drug allergies, medical history to rule out contraindications, check name and age on the reports, confidentiality, WHO checklist for all surgical procedures. These are common things which will be patient safety in most of your stations. Incident report if required, red flag signs, safety advice, emergency contact numbers, give the information leaflets. If any drug is used in unlicensed condition, explain the patient that, like if you use acyclovir in the first 20 weeks. So you would say that this is the drug I'm prescribing to you because this is effective in this case, but it is unlicensed drug. So you have to be very clear about it. Involve the consultant and other specialties wherever it is required. So this is how the domains will go like. So finally, with your knowledge, creativity, proper personality development, communication, with time management, you can effectively pass this exam and get your degree. And that's what we will be working on. You are not alone. We are here to support you. And there will be complete hand-holding till you pass your exam. If you haven't enrolled with us till now, then you can. Otherwise, I think most of you are already our students. So that's it. Any more questions? Anything you guys want to ask? And from tomorrow, we start our journey and we will go ahead successfully. Any questions? Anything you want to ask? Anything anybody wants to ask? Thank you so much for joining. Thank you. Thank you.
Thank you,
Okay.
ma'am.
Yeah, thank you. Hope that was a clear information.
Yes, ma'am.
Yeah. Okay.
Thank you.
Okay, so I'm going to post the work group link and you can just join in that group and start working from there. Dr. Shivani and Dr. Shia will be there. They will be guiding you throughout. And of course, I'm always there, right? Okay, bye-bye. See you again in the next live session. Take care. Recording of this live session will also be available. So you can just go through that again. Yeah, live session schedule, I'm just going to post right now in the group. Okay. Okay, bye-bye. Take care. Have a nice day ahead.